Greetings, citizens, and welcome to another edition of Flashpoint, a television program of issues and ideas. Flashpoint is brought to you by the Lawrence Debate Union, an endowed co-curricular activity at the University of Vermont that trains UVM students in the arts and skills of debating, argumentation, public speaking, and persuasion, and then has them compete against other sentient beings from throughout the United States and the rest of the world in communication competitions. And we do a lot of other things too. One of the other things we do to promote discussion and discourse in our community and the world is to bring you Flashpoint. If you want to check out Flashpoint, you can go to our website, which is debate.uvm.edu, click on the Flashpoint link, and you'll go to a page where you can get lots of different stuff. You can download them as podcasts, you can watch them streaming as real media signals, and you can just have all the Flashpoint you could want. But here in Burlington, Vermont, we're very happy to be broadcast by Channel 15 and Vermont Community Access Media. My name's Alfred Charles Snyder. I'm the Edwin W. Lawrence Professor of Forensics at the University of Vermont. Ain't that a mouthful? And I'll be your facilitator for this generously giving program. Let's meet our panelists for this week's program. On my right, I have Alex Thibault, who is from Hudson, New Hampshire.
That's correct.
What would you do for a good time in Hudson?
Maybe go fishing.
Okay.
There's not a whole lot to do there.
Not a whole lot to do there?
We go to Manchester.
Okay. You're just finishing your 4 years here in Burlington. How have you enjoyed? Have you enjoyed the University of Vermont or what?
It's been just an amazing experience. I've grown so much in the past 4 years and exponentially in just the past this last year.
Mm-hmm. Mm-hmm. Great, and I know you're very popular on the debate team. Everybody likes you, and you're going to be very much missed. So
I hope so.
There you go. But now we got to get you a job and get you rich so that you can give back, right?
That's right.
Okay. On my left, I have Joe Torda, who's a junior at the University of Vermont. You're a double major?
I am. I double major in English and political science.
Okay. And which one do you like better?
I think that I like political science better now.
Okay. All right. And what's your experience been on the debate team for a short time?
Well, I've only been on the debate team since January, but I've been to a few really wonderful tournaments, and I had a lot of fantastic competition. And also, I've experienced a tremendous amount of support from the rest of the team, both coaches and other teammates. It's really a very welcoming community, and I've been having a great time.
So, and you're excited for next year?
Absolutely.
All right, as are we all. And especially, Alex, maybe you can come judge for us.
Yeah, I'm down.
All right, that's down. We make you a coach, buddy.
It's on tape.
That's all right. We got his commitment. Well, let's get to the business at hand. This is Flashpoint Show number 337. If nothing else, we are determined. And the subject of this show is organ donation. Increasingly, organ transplant operations are becoming easier, more successful. In fact, they're now so successful and so standard that there's a serious shortage of organs. But, we're just not talking about tin cans or silver cups or something. We're talking about human organs, and all of a sudden you start talking about them in an economic supply-demand notion, and people kind of freak out a little, and there are some ethic as well as practical issues. And how far should we go to promote more organs needed for donation? How should we give them away? What are some potential problems with this in the future, or maybe even right now? These are just some of the things we're going to talk about on this edition of Flashpoint. Let's start by saying, why do we need organ donation?
It saves lives. There's a huge shortage right now. I would say that I think there's 92,000 people on the waiting list for organs right now. And we only have the supply only grows about 25,000 a year as far as organs being donated. So and then about 6,000 people die each year waiting on this list. Mm-hmm. How many?
I believe the figure was 18 people per day.
Die while waiting.
Die while waiting, yes.
Yeah, and also there's a very serious compromising the quality of life. If you have to go for kidney dialysis, it's really affects your lifestyle. It's also painful. It's very debilitating, and the kinds of things you can and can't do. It's very hard to lead a normal life. So that's a problem. What kind of things is, I mean, we always hear about kidneys and stuff, but I guess there's a lot of stuff that can be donated.
Absolutely. Post-mortem, you can donate kidneys, heart, liver, lungs, pancreas, intestines, cornea, skin, bone, and bone marrow.
Yeah, and I know someone just the other day who had an intestinal transplant, and that was the first I had heard about that. And so really, and he was at the end of the rope, right? There wasn't anything else that he could do with that. You know, without intestines, it's hard to live.
Yeah.
And so that was, okay, well, why don't we have enough? I mean, we have people dying all the time, right? What are some of the barriers for people, donating?
Well, in the United States, we have a system based on altruism where we can only donate out of the goodness of our heart. We're not allowed to give financial incentives or any incentive that give value to your organs. So that has a lot of consequences as far as creating shortages.
Yeah, I think also a major issue is just that a number of people feel uncomfortable with the idea of allowing their organs to, I don't know, to separating their organs from the structure of their body after they've died. You know, they like the idea of being buried in one piece. And I mean, oftentimes families they'll want to have like, an open casket, and they want to have their loved one intact.
Many religions forbid like those types of procedures. Something to be.
And it just seems kind of Frankensteinish.
Sure.
Where you're taking parts of one person and putting them into somebody else, and so that seems kind of icky to people sometimes. Frankenstein's become kind of a big buzzword.
Right.
Like that.
Yep.
I think also the way in which we ask for organ donations is kind of strange.
Yeah, it's true. Oftentimes, a family member will die, and then within, minutes of this family member's death, you're asking the family who's devastated, this person hasn't signed any sort of, living will or no sort of approval for organ donation, but time is of the essence. So we need to know, can we use, this heart or their eyes, and that's not necessarily the first thing that you want to hear when you've just heard that your husband has died.
Yeah, can we chop your husband up and use him for another time? The answer would probably be, go away.
Yeah, get out of here. But
about 13,000 people die in a manner that would allow their organs to be used as transplantable, and about a third of those are collected. And also, families about half the time deny those requests by hospitals. So.
Well, there have been some attempts to overcome this, and that's by trying to get people to indicate this while they're healthy and while they're younger, that they approve of this, which would seem to me that would be more effective.
Yeah, I believe that there is a slight financial incentive in what state was it? Georgia, where upon getting your driver's license, they offer you a $9 discount. A $9 discount.
Wonder how they arrived at that figure.
I don't know. I mean, just under 10, but maybe just enough to convince you to state that you want to be an organ donor, and you get $9 off your license.
Despite education programs by the United States to increase the amount of donors, the number of donors has pretty much stayed the same throughout. For example, 30 to 40% of Americans sign their donor card sign their driver's license as a donor.
Currently, only a little more than half of the 14,000 people annually who die in circumstances that make them suitable donors give organs. All state governments and the District of Columbia have tried to encourage donations, by asking people to sign up when they apply for a driver's license, but it hasn't proved very successful. And this is the difference sort of between the opt-in and the opt-out philosophy that maybe we should explore. The opt-in philosophy is where you say, yes, I want my organs donated. And then that's how you would handle it. Everybody who answers yes gets. The opt-out policy is, unless someone says, no, don't transplant my organs, right? Then it's assumed to be okay.
So as long as you're not explicitly stating that you don't want your organs used, then your organs will be used.
Yeah, how do you feel about those two options?
I think, for me, absent any other option, I think that is a good way to increase the amount.
The opt-out?
Yeah, the opt-out. I think that's a good good plan.
I mean, I think I understand that this is an incredibly serious issue, and that we are really lacking in the just like there aren't enough organs. But at the same time, if you have this sort of policy enacted, then what other situations would this sort of policy become appropriate for? If the government's saying, we're going to do this unless you tell us explicitly that we can't. I mean, if that starts to be enacted in other types of policy, like that would make me very uncomfortable.
The problem is that most citizens are fairly lazy about this. They don't investigate. You could pass, such a law at the state level, and the vast majority of people wouldn't even know about it.
Right.
So they wouldn't even know whether they would opt out. But you don't mind that.
I mean, I think there are better alternatives than an opt-in, opt-out policy.
All right. Well, let's talk about incentive programs then, and different ways that we can. And I guess the first would be just to try to create a mindset in our society of organ donation. And that's tough because you have to strike at, people's vision of who they are in relationship to their body.
Yeah.
Right? Are you your body, or are you something else? Or that's a hard re-education.
Absolutely, that's a very difficult issue, and also personal relevance. It becomes, you say abstractly, you may at some point need a kidney transplant, but you're saying that to a 20-year-old healthy person, and they say, yeah, maybe, but I mean the chance seems so distant that it's very hard to get someone relatable. And I mean, oftentimes, like religious stigma or some sort of concept of your body as and your living organs as pieces of your individuality. I mean, that can trump any sort of social or moral responsibility toward others.
True.
Yeah, I mean, it's a pretty good question to ask. I mean, let's take your hand, for example. Your hand is very important to you. It's different for every person. We have this personal hand, but is that you?
I mean,
right?
Personally.
Let me just, I mean, the only way you can answer that question is personally.
Yeah.
What do you think personally?
After I'm dead, any part of my body can be used for the betterment of anyone. If there's a sick person that can benefit from any part of my body, even the parts that I hadn't listed earlier. I don't know, if you find some use for another body part, use my hair for a wig, fine. Something like that, anything. I think that once I'm dead, I don't need it anymore.
Right. But apparently a lot of people don't necessarily think that.
Yeah, no, it's not a very popular viewpoint.
Okay, here are some incentives that have been. Well, the first would just be to create a general mindset.
Yeah.
Okay, how about this proposal? That unless you have been a donor listed before your illness, it changes the likelihood that you would get an organ if you needed it.
So
right, so that people who have been donors early would go to the front of the line as a way to. How about that?
Well, see, I've got
because that actualizes your thing.
Yeah,
you
absolutely.
may need a kidney.
No, you're absolutely right. I have a question though. I mean, I may feel a little bit excluded from that proposal because I don't have a driver's license now. I haven't had an opportunity to state in the eyes of the law that I would like my organs to be donated. It's not, I mean, and
Yeah, but
so,
you could do that. You could.
How?
You can do that.
There's
You can't-
state.
Yeah,
run,
yeah. I bet
donor
I
registries.
bet you could register even if you didn't drive.
Yeah.
Okay.
Okay. So yeah. Let's say you could register.
Then it sounds.
Well, you're already giving away your body parts, right?
Right.
You're down with that.
That's true.
But how about saying you'd be the first in line if you were a donor? You think?
It's quite an incentive, but still, I think it goes back to what Joe was saying: is that we're like removed from this decision because we're not expecting to need a kidney down the line. So it definitely would, I think, have some effect, but I don't think it would solve the shortage problem.
Okay.
I think it's a good idea.
Right, and it might lead to some pretty hard feelings later with people who answered no to the question, and then they need a new kidney, and they're told they're at the end of the line
Yeah.
because they said no. That might be. Okay, here's some other incentives. $9 off your driver's license.
It's not enough.
Okay,
I think, I don't know the numbers, but I think, yeah, maybe it's not quite enough, but at the same time, a lot, like, that's a very, like, you may not have any, like, concept of, like, yeah, my organs are going to the betterment of others, but you could say, that $9, like, what the hell?
Right.
I'll do it. Sure.
I can buy a hamburger with $9.
Yeah, I mean, I mean that it could be. I mean, if you were to offer, say, maybe slightly more, like $30, then I think that you'd see an increase in the number of people willing to donate organs.
Let's talk about direct payment for organs.
Yeah.
Okay.
And I heard you talking earlier that there's some people who are like estimate how much
Yeah.
you should get.
I don't know the exact number. I think an economist estimated that a kidney would go for about $35,000 on like an open market if everybody was participating. I think,
That's a lot more than $9.
yeah.
Right, but the kidney is one of those things where you can give up one of your kidneys because you have two.
Yep.
So you can give them up. So the kidney is one, and I guess we need to make the distinction between live transplants, right, and post-mortem transplants.
I mean, yeah, we do.
Well, you can do kidney, right? You might be able, and people do
marrow.
bone marrow, okay? And I know people have done skin, right? So is there any problem with that? Just how about money for stuff that you can take while they're alive?
Well, then you raise the issue of people that are in a more dire financial situation being more susceptible to being forced into giving up their organs.
Joe, let me ask you a question. Would you donate your organ? Like, you're a poor college student. Like, you're going to tell me that you would not donate your organ?
No, I've already said that I would, but not for
You'd take the
financial
money,
reasons.
though.
I would certainly take the money if I could.
But I guess what my point is that, like, just because someone is poor and needs money doesn't mean that they're going to, if they're going to sacrifice their, like, morals of, like, not giving up their body parts if they don't want to. Just because they're poor doesn't mean they don't have the ability to make their own decision. I don't think we need to decide for them.
Well, but it's like there's poor and there's poor.
Yeah.
I don't think very many people in the U.S. would give up their kidney, but there is quite an issue in some Southern Asian countries like
Definitely.
Pakistan and India and Sri Lanka, where people are selling their kidneys because they can live without it, as well as people being kidnapped and then coming to a week later and finding a big scar where their kidney was.
I have a story about there are secret Chinese concentration camps with that hold political prisoners, and they have a hospital wing. And a wealthy, say like a wealthy American, can pay $150,000 and 2 weeks later receive an organ from one of these people. These camps are acting as like a reserve bank for organs. Also, in India, there's like entire villages that have sold kidneys for like $800. So while the organizers were making $150,000 for a kidney, these people are making $800. So Joe, you said that like people in the United States might be getting exploited, but it's not. This argument doesn't apply because people are already being exploited. The only way to solve for exploitation is to solve for the shortage problem.
And the need generates the demand.
Absolutely.
Right. The way I heard the China story is about prisoners on death row who are waiting to be executed, they literally don't execute you until they need you, right? And a lot of overseas Chinese especially go there, and because they would like Chinese organs, and then they go there and they say, oh yeah, you're a perfect match for prisoner 503, and then prisoner 503 gets executed.
Yeah.
How do you feel about that? They were going to be executed anyway, right? How do you feel about that? Might as well get some value out of it.
Yeah, I mean, I think that it's pretty terrible practice. While I agree that their organs, should go to use. Like I don't know if keeping them alive until they're needed is moral.
That's talk about commodifying these.
Yeah,
people and their body
it's like this
Okay,
person.
well, dude, you guys have already commodified body parts. Okay, you've already said that, so isn't this the obvious next step?
Well, these people are consciously aware of the fact that they're being farmed.
They're consciously aware that they're about to be killed too, and so I guess the argument you don't want to scare prisoners on death row. Well, they're already probably pretty scared. So I'm just asking. I find it reprehensible myself. I just wanted to know what you thought. Okay, how about this? An income tax or a state benefit. That more of your money gets passed on to your heirs, or you would get an income tax if you did it when you're alive. Benefit.
I think that solves like an income tax break would solve the poverty problem. Say you get a 50% break on your taxes the year that you donate. That means that the people who are the wealthiest, who are paying the most taxes, are going to have the biggest incentive to donate. Also, they're
the ones with big estates to pass on too. So.
Yep. So that definitely solves the problem of exploitation of the poor.
Right, we exploit the rich, but they do it willingly. Okay, how about this? A reimbursement for funeral expenses. Now, funeral expenses can be fairly high, and a lot of people are not prepared for it, and a lot of times it falls on their children to have to take care about that. How about that one?
I think that's an interesting proposal, because I know that oftentimes funeral homes are where persuasion takes place, like in mass. I mean, they take ready advantage of the grieving, and so that if you were to, I don't know, though, it might increase if you know that you are not paying for it. It might increase the likelihood that you'll get a more expensive or extravagant funeral at the expense of the American government.
How about this? That the family, let's say I die and I don't leave any preparation for a funeral, and my daughter doesn't really want to pay for it, but then she can give permission, right, for my organs, and then my funeral would be taken care of and it wouldn't hurt her. So that's because we had talked about only 50% of families say no. This might be a way to, but I don't know how many more families would do it. Okay, let's try this. A contribution to a charitable organization. By the way, these are from an article by Francis L. Delmonico entitled Financial Incentives for Organ Donation. A contribution to a charitable organization determined by the family or the deceased.
I don't think I don't think that would work nearly as well as like direct financial incentive.
I agree.
Because it would be great. A donation has been made in your name to charity of your choice, but I think that people would much rather see the money in pocket, or going towards something that they would be paying directly themselves.
We can
anyways,
give them the money, and then they could decide what they want to do with it.
Sure.
Okay. You don't think there's pretty much anyone that would really appeal to?
I mean, maybe, but at the same,
very many.
yeah, and maybe if you were to offer, a larger donation to charity of your choice than the actual money that you would have received, say, I don't know, that maybe would motivate some, but I think that more often than not, people would prefer to have the money in hand.
I think something that we need to talk about that we haven't discussed is like all these incentives are illegal right now under the National Organ Transplantation Act. Any valuable consideration for an organ is illegal, and the biggest opponents of financial incentives are hospitals, organizations that move these organs across the country, and I think we need to take these
Wait a minute, those groups are opposed to incentives?
They're imposed to incentives.
Oh, why?
Because it's $1 million business. When you think about it, everybody's making money on organ transplants except for the person donating the organ. It's really terrible. It's like they have a monopoly on organs, and it's when you think about it, there's little like why not keep it down if you're keep the price down, keep the supply down, or keep the price up by keeping the supply down if you're making money on it.
How is a hospital making money off an organ transplant?
You got to pay the surgeon. You got ambulance fees. You got room and boards, room and board. You get like stay fees. They make tons of money at the expense of the person receiving the organ and their health insurance, which in turn drives up costs, just general healthcare costs up, which are huge in the United States.
Right, so everybody's making money off it except the person the organ comes from, so why not?
And that's pretty reprehensible.
All right, here's what some opponents say. Said if we have these financial incentives, they could risk the withholding of medical information that results in the transmission of donor disease to the medical recipient. In other words, if I died, you wouldn't tell them that I had disease X because you want to get the benefit for your organ. How do you feel about that?
I think that's actually a very valid point, and I think that we'd have to do proper. But the great thing about incentives is that before you die, you can get all the testing done, and so we have the best testing available. So it is a problem, but I think it can be solved.
Yeah, and I mean, but that also raises an issue in and of itself. That means that you need to decide whether or not you're going to be an organ donor before you die. Because like after postmortem, there's like a time limit, and you need to get the organs out and then into whoever needs them as soon as possible, so that you may not have time for adequate testing. And so the decision because of this sort of situation, the decision would have to be made before death.
But how about this? It would influence the family of a patient to prematurely withdraw care. So you would want to withdraw care, so I would die, so you could cash in. Is that a serious problem?
I think that's the same argument, or I would respond to that. It's like you're just putting words in you're putting words in these people's mouths. Like, how do you know they're going to behave like that? I know my family wouldn't do that.
This is what Dr. Delmonico is worried about.
I think it's an understandable fear, but I don't know. I don't know how like credible that would really be. Like I don't know if someone would actually like be able to put that much of a price on the head of a dying loved one.
Okay, well, we've come to the end of our show. There's always a lot of stuff to talk about. No shortage of ideas. You know, the last thing Dr. Delmonico says is that this would result in the perception of the human organ as a commodity. And my question to you is, and I need a short answer, do you think that's okay that we perceive as human organs as a commodity or not? And let's start with you, Joe Torda.
I think that human organs are already perceived as a commodity, and I mean it may increase public knowledge of that viewpoint, but I think that it already exists, and the way things are going, it's going to be worse and worse. Alex
Thibault, is it okay to commodify human organs?
What does that even mean, to commodify human organs? Why is that necessarily bad? Like when we offer incentives, we are saving thousands of lives every year, and that's what we have to weigh all these supposed disadvantages against, is the lives we save.
Okay, I think there's a lot of danger in thinking of human bodies as commodities for a lot of other reasons that could be frightening and scary. But we don't have time for that now. Well, thank you two for being on Flashpoint. Thank you for watching Flashpoint again. Don't forget, think for yourself.